Good afternoon. I'm Cedar Rapids Mayor Brad Hart. As you probably know, and as you will hear shortly, we continue to see an increase in confirmed COVID-19 cases and deaths in Iowa, and certainly in Linn County. Now is a critical time for our community to step up and to slow the spread. To do that, we're urging everyone in our community to wear a cloth face covering whenever they're in public. If you're outside your home, you're outside your car, or when social distancing is difficult to ensure. The CDC is now recommending that everyone wear a face covering when they're in public. Let's all step up and be an example for each other. If we all commit to wearing a simple cloth mask, it will slow the spread of the virus because it will prevent people who have the virus and may not know it from spreading it to others. I'm certain that many of the cases we have now have come from people who were hanging around others who didn't seem sick, but at the same time we're still spreading that virus to others. Cloth masks that cover your nose and your mouth should always be worn when you're going out in public, especially to grocery stores, home improvement stores, pharmacies, or any other retail location that's open. I'm really asking everyone to commit not to go out to these public places without a mask. Masks can be made at home from lots of common everyday materials: t-shirts, scarves, bandanas. The internet is an easy place to find out how to make a variety of masks, and you can also find information available on the cdc.gov website. Masks should not be placed on children under the age of 2. The city is working to lead by example in this effort to ensure every city employee who needs a mask has one. Many city employees have stepped up to make masks for their coworkers. We provide the volunteers with the materials and the instructions on how to make the masks and then distribute them to the employees who need them. I'm really proud of this effort and would encourage other local companies to do something similar for their employees. On the way down here, I just found out that HACAP is asking for cloth face mask donations, and they will distribute those with food packages for those who need them. I think it's a great idea. Wearing face coverings is an additional public health measure that we can all take to help reduce the spread of COVID-19. But residents still need to stay at least 6 feet away from others, wash their hands frequently. Don't touch your face, cover your cough, stay home whenever you can, and especially stay home if you have any symptoms of an illness. A very big thank you to the many people who are trying to do the right thing, who are staying at home and are wearing a mask when they're out in public. Thank you. Please keep up that great effort. However, there are still too many people who are not following the recommendations, and they're putting themselves, their family, their coworkers, their friends, and our community at risk. We can and we will come through this together, and we'll do it sooner as if everyone will do the right thing. Show you care by staying home whenever you can and wearing a mask when you're out in public. This is so important, and it is a critical time for our community. So I encourage everyone to do what you can, do the right thing, stay safe. Thank you.
Good afternoon. I'm John Spear, Chief Administrator of Grantwood AEA, and I'm here today to share information on behalf of our school districts in the Grantwood area service area. I'd like to share information with you today, updated guidance from our Governor, Kim Reynolds, and the Department of Education. On Friday, Governor Reynolds closed school districts for the remainder of the academic year. That means that districts in Grantwood AEA, along with all districts around the state, including our 7-county service area, Benton, Cedar, Iowa, Johnson, Jones, Linn, and Washington counties, will be physically closed for the remainder of the academic year. From the beginning of this period, schools have been planning intently for the possibility that school would be closed for the remainder of the year. But Friday's decision gave districts important details that they needed to continue to move forward. Specifically, districts know that they will not need to account for the time missed if they're involved in continuous, voluntary, or required learning. Districts also were informed that they may have flexibility in establishing a fall start date earlier than the legislatively mandated August 23rd. These were important details districts needed to continue planning for today's unexpected reality. And all of our educational partners have been working hard during this period of closure. Schools have been planning for several weeks to meet guidance by the Department of Education in the areas of continuous learning, whether it be voluntary or required. Each district's plan looks a little bit different, but please know that every district continues to roll out this information as they get it ready for their students and families. This planning will culminate with a plan called Return to Learn, a required document by the Department of Education of all districts that will outline how they intend to begin educating students in the fall. Each of our districts will individually develop and share information on all of these areas with their families as they continue their planning. I specifically wanted to address seniors and the families of seniors this year. With her April 10th proclamation, Governor Reynolds temporarily suspended state-mandated graduation requirements for the class of 2020. The Iowa Department of Education further indicated that decisions around awarding credit for coursework and what stipulations current seniors must meet to graduate is a complete, total, and local matter. Each individual district will make their own determination on those issues. This guidance is shaping the decision of every district in Grant-Wood AEA and across the state. But I want to make it very clear that all area schools are working diligently to ensure that every student that was on track to graduate prior to this closure will do so this spring. It's universally accepted that no student be harmed by circumstances outside of their control. On behalf of our district and educational partners, we want to take a moment to address the impacts of these policies on our students and families. Our partnering school districts and our AEA staff are working to support instruction and education to the best of our abilities during this time. But we also have a heightened concern for the mental health and the well-being of our students. Friday's announcement to close schools for the academic year, although not surprising, carries a weight and impact that none of us can fully appreciate. Students and families are missing the traditions and camaraderie that comes along with this time of the school year. Please take time for your own mental health, along with the mental health of your students. Ask them how they're doing, check up on them regularly. Grant-Wood AEA and many of our districts have partnered with Foundation 2 for crisis support services. And we encourage you and your family to reach out to their professional staff if you're concerned about the mental health of your students. Foundation 2's crisis line can be reached at 1-800-332-4224. Again, that's 1-800-332-4224. You could also reach help by dialing 211. We understand that our schools are vital gathering places for our students, our parents, our staff, and our community, and we look forward to that time when reopening our school doors align with public health recommendations, and it's in the best interest of our students, our families, our staff, and our communities. Today, more than ever, we're in this together. We look forward to sharing additional information with you in the near future.
Good afternoon. I'm Linn County Sheriff Brian Gardner. Yesterday, we learned that a deputy sheriff assigned to the Linn County Correctional Center had tested positive for the COVID-19 virus. The deputy last worked during the evening shift on Thursday, April 16th. He arrived to work fever-free, as verified through a process previously put in place requiring the temperature be taken of all persons entering the correctional center. However, he left work near the end of his shift when he became symptomatic with a 102-degree fever. A test for COVID-19 virus was administered, and yesterday he learned that he was positive for the virus. The deputy has since been advised to remain in self-isolation until he meets the IDPH guidelines for returning to work. At the time that he became symptomatic, the infected employee was assigned as one of our first floor booking or intake deputies. The jail administration had previously worked with the court system to reduce both the number of inmates in custody and the number of new inmates brought into the facility. This process would lessen the number of inmates with whom the deputy would have direct contact. Although the enhanced cleaning activities were already in place in the correctional center and continue on a continual basis, two more thorough sanitization processes to help reduce the chances of virus spread have occurred since the time that the deputy went home ill. The jail administration worked cooperatively with and assisted the Linn County Public Health Department with their contact tracing process to identify those persons with whom the deputy may have inadvertently exposed to the virus. Exposure means that a person was within 6 feet for more than 2 minutes with the deputy who has been confirmed in having the virus. Exposure does not mean that the person has contracted the virus. In speaking with the infected deputy and utilizing the jail's video recording system, all 11 exposed coworkers have been identified and notified of the exposure. As essential services personnel, they will continue to report for duty as long as they remain asymptomatic per the IDPH guidelines. In conferring with Linn County Public Health Department, it was determined that no inmates were exposed to the virus by the infected deputy. The health and safety of our employees and the inmates are of paramount importance. Although we have taken numerous steps to help reduce the chances of COVID-19 virus affecting our operations, an exposure to the virus was still a possibility. We continue to follow the guidance and protocol of our public health professionals to ensure that the virus does not spread throughout the facility. As part of that continued exposure reduction process, in addition to the taking of temperature of all persons entering the correctional center, all employees and visitors are now required to wear a face mask when in the secured area of the correctional center. Additionally, face masks are being provided to all inmates within the correctional center. While they are not required to wear them, they are being advised and encouraged to strongly encouraged to wear them. Thank you.
Good afternoon. My name is Heather Metter, and I am the supervisor for the Clinical Services Branch at Linn County Public Health. As of 1 p.m. today, there are currently 456 cases of COVID-19 in Linn County. There have been 29 deaths, and 177 individuals have recovered. Over the weekend, Linn County experienced a large increase in the number of COVID-19 positive cases due to testing at nearby meat processing plants. 59% of the 148 cases reported since Friday are linked to the meat processing plants. These increases are a reminder of how easily this virus is transmitted, and that we continue to have community spread of this virus. All people are at risk of contracting this virus, and everyone should do what they can to prevent the spread. As businesses prepare to reopen in the future, business leaders should recognize the importance of social distancing and the importance for employees and customers to wear cloth face coverings. As I just stated, Linn County has 29 deaths. We are beginning to see deaths in our community that are not associated with identified outbreaks and that are associated with community spread. This includes individuals that are between the ages of 50 and 60 and were otherwise healthy. We have stated this many times. Every interaction you have with a person is a potential contact with COVID-19. As a reminder, Many people that have tested positive have had no symptoms or extremely mild symptoms. 80% of the population that becomes infected with COVID-19 will have mild enough symptoms that they can recover at home. However, we don't know who the 20% of those infected with COVID-19 will be that will have serious complications. Those 20% may require hospitalization or even die. That could be you. That could be someone you love. We continue to follow up with 2 outbreaks at Linn County long-term care facilities. At Heritage Specialty Care, 109 staff and residents have tested positive for COVID-19, and 20 residents have died. 34 residents have now recovered. At Linn Manor Care Center, 18 staff members and residents have tested positive. 4 residents have died. Linn County Public Health continues to be in daily communication with both of these facilities. In addition to working with our long-term care facilities, Linn County Public Health is currently investigating spread of COVID-19 within 2 congregate living settings. Social distancing, personal hygiene, and environmental cleaning are critical to reduce the spread of disease within group homes and other similar living arrangements. At this time, we are not releasing the names of any organizations, as this is an ongoing investigation. Linn County Public Health will work with these organizations to help provide testing, guidance, and personal protective equipment. The governor's orders for Region 6, which we are part of, went into effect and will stay in effect until April 30th. These orders limit social, community, recreational, leisure, and sporting gatherings. We are limited to only having people who live together in the same household participate in gatherings, except for religious gatherings such as weddings and funerals. At those gatherings, there need to be less than 10 individuals present. I am bringing this up because over this past weekend, we had another beautiful time and a great time to be outside. While it is important for physical and mental health to get outdoors and to be active, the governor's orders also apply to outdoor settings. The only people you should be outside with are those in your immediate family. COVID-19 does not know if you live in a rural or urban community. It doesn't care. You need to protect yourself, your friends, and those you don't even know by following social distancing guidelines. We also want to remind you that this is a misdemeanor and is enforceable by law enforcement. We're fortunate to be in an age of technology where connecting with others virtually is possible. It is important to stay in touch with others. Per Dr. Shahida Fareed, staying in touch with people feeds the human connection. We all need to thrive daily, but physical distance is vital to slowing down the spread of the COVID-19 virus. Businesses that remain open that have not implemented their own social distancing measures to protect their staff and customers should begin implementation now. It is imperative that we all work together. Together, we can protect each other. This is a marathon. It's not a sprint. Stay home, stay safe, and be well. Thank you.
This is the end of today's prepared remarks. We do have time for some questions from our media. For the media that are on the line, please indicate to the moderator if you have questions. We do have some questions from Kate Payne at Iowa Public Radio. We'll start with her questions. She did send these ahead of time. I'm going to read them as worded, and they do relate to a few things that Heather discussed. The first question is, how are the cases at Tyson and Waterloo affecting Linn County? Are there Linn County residents who work there that have tested positive?
Kate, thank you for that question. Yes, we have many residents within Linn County that do work at the meat packing plants that are outside of our county. As we stated earlier, 59% of the 148 cases that we have received since Friday are associated with those meat packing plants. So yes, it does have a large impact on our county, but also on surrounding counties. These are large employers that do employ individuals from numerous areas, so it has had a large impact on our county. Thank you for your question.
A few more questions from Kate, also for Heather. For contact tracing, how many staffers are now working on contact tracing in Linn County? And on average, how long does it take to trace a positive individual's contacts?
Again, thank you for the question, Kate. So right now, we do have our full-time staff members that are working on contact tracing, plus we have residents from the Cedar Rapids Medical Education Foundation that are helping. We also have students associated with the College of Public Health in Iowa City that are helping. And we have other nurses and volunteers that have come in with expertise to help with that. So right now we have about 15 people that are helping with the contact tracing. And contact tracing, it really depends on the individual. When we're talking to someone, we may be able to do most of the work we need to obtain the names, numbers, contact information to address those individuals within about an hour. It may take a day or two to follow up with all those individuals, depending on if we can get a hold of them or not. However, we also know that it's hard to remember when you're going back in time everyone that you may have had contact with. So we do provide our phone number, our emails, and we will have individuals contact us again saying, hey, I just remembered I was with this person or I was with this person. There's somebody else at work. So it can be ongoing. For some people, it may take a couple days before we can get all that information so that we can follow up with those individuals. It's an ongoing process. We will not put a time limit on it, and we will continue to follow up as information becomes available. Another note is we do have individuals that work for us that speak multiple languages. We have individuals that speak Swahili, French, Kinyarwanda, and other languages. So we do have people on staff that can help with translation if needed for our residents that do not speak English as their primary language. If we do not have a staff member that speaks those language, we do work with agencies that do have interpreters that can help us with that interpretation. Thank you.
The final two questions from Kate were answered. They were regarding language interpretation and outside help with employees or working with hiring other staffers to conduct contact tracing. Next, I'm going to go to Adam Karos, who is on the phone. Adam, go ahead with your question.
Hi. My first question, I think, is for Heather again. Looking at testing capabilities, what is Linn County's testing capabilities now? How many tests do we have per day? And how many would you like to see us get to where we might feel safe to even start to think about reopening at this point?
Adam, thank you for the question. It's about testing and about capability. Right now, it's kind of a hard answer, just because that fluctuates on a daily basis. So there are different ways to do testing. We have the State Hygienic Lab, which provides testing. It does have very strict guidelines for that testing, but we have been able to test anyone that we need to at any time. The State Hygienic Lab and the Iowa Department of Public Health have opened up those guidelines. So if there's an outbreak situation at any type of employer, that we can go in there to do mass testing. There's also our reference labs, which are not associated with Linn County Public Health, with the Iowa Department of Public Health, or with the State Hygienic Lab. Any provider can order a test for any individual at those labs. However, we still do not want individuals tested at this time that do not have symptoms. We do not want to be testing individuals for return to work status because we're still limited on our personal protective equipment. So we really need to get more of that personal protective equipment available so that we can do more testing. We do need to increase the amount of testing we do so that we can really look at the disease burden within our communities. So to answer you how many tests are per day, it's going to depend. We have multiple clinics. Both Mercy and Unity Point have their respiratory clinics, the emergency departments. We have our other clinics within our community that are doing testing. So that number is going to fluctuate daily. People can get tested, but we do need to still be careful of who we're testing, when we're testing, because of our limited personal protective equipment supply. Thank you.
So is the personal protective equipment really the main thing holding you back, not the availability of the test kits necessarily?
So Adam's also asking about the availability of the test kits. There are different parts of the test kits. You need to make sure that you have enough of the nasal swabs available to do the swabbing. You also need to make sure that there's enough reagents available. So although we can test those that need to be tested, can we do mass testing over the whole population right now? Test all of those that are asymptomatic or not, so that we can really see the disease burden? Not at this point in time, no.
We also spoke earlier this week to the Linn County Medical Examiner, Donnie Linder, who had done a stint at a hospital in New Orleans where they had rapid testing that could give results in just a handful of minutes as opposed to several hours and maybe days in some cases that we look at here. Are those tests available in area hospitals, or is there an effort to try and make those more available locally?
So the state does have some of the rapid testing kits available at this time, and that's for large outbreak situations. They will deploy those kits out. However, I'm not aware of any of our providers within our community having the rapid testing kits available at this time. I think it's something that everyone would love to have, but it's still one of those things that's pending for our community.
Just a matter of having enough tests to be able to deploy them widely at this point?
You have to be able to purchase the equipment. And so I think there's limitations on purchasing the equipment at this point in time.
Gotcha. Going back to the long-term care facilities, you said you've got 2 more investigations that are underway. Can you explain why you're choosing not to name those facilities at this point? Because from my understanding from the law, you're not required to say them, but you can identify them in the interest of public health. Why not do that at this point?
At this point, we don't know what's occurring at those facilities, and until we actually declared an outbreak, we would not be naming that facility, as that would put undue stress on that facility as they're trying to take care of their staff and their residents. So once we have determined that there's an outbreak, then we can work with that facility for naming them. But at this point, this is an ongoing investigation.
So when you say it's an investigation into what's going on, is it that they have cases, or that you're not sure, and you're not sure if it's an outbreak, or we're not sure that it's COVID at this point?
We have not. Right now it's an ongoing investigation, and we are determining what illnesses are being spread around and the extent of those illnesses. So we are in the middle of an investigation. So we are still conducting tracing, or contact tracing, and we're still conducting testing.
So there are cases at these facilities that you're looking into to see if it's more of an outbreak than an isolated case. Is that what I'm?
Again, it's an ongoing investigation, and so until we have more information available, that's all we're going to let you know, is that we are investigating group homes that may have an outbreak at this point in time. But until we have concluded our investigation to know exactly what we're going to present, we're not going to present any additional information.
So what would be your threshold then for, is it just the completion of the investigation, or is it a specific number of cases, or what is the threshold for when you would name?
It depends on what we find on the investigation. So group homes are limited in size many times and staff numbers. So I'm not going to put a metric on there. It's going to depend on what we conclude with our investigation.
And so is there a requirement, are those homes required to notify residents or notify families of residents if there's cases?
Adam, this is Caitlin Emmerich from Linn County Public Health. I'm going to ask to hold your further questions about the ongoing investigation until we're able to release more information. I am going to go to Isabella, who also has questions for Heather. Isabella, go ahead.
Yes, my question is for Heather. I was wondering if Linn County Public Health has been tracking the race and ethnicity of residents testing positive, and if there's a plan to make this and any other additional information public.
We have started pulling all of that data together. So yes, we are pulling all that data together, and once we have that more solidified, we can look at releasing that data. But yes, we are looking at that data because we know that there are populations that are disproportionately impacted by COVID-19. So we do want to be looking at that information so we can look at how we can best serve those communities that are disproportionately impacted by COVID-19.
And going back to the 11 employees that Sheriff Gardner talked about, will those employees be tested for COVID-19 after being identified through contact tracing?
They will not be tested unless they become symptomatic. So at this point, we are not encouraging testing of asymptomatic employees unless there would be an outbreak at a facility, and one individual being sick at a facility would not constitute an outbreak.
Okay, thank you.
Thank you.
This does conclude our press conference for today. Our next scheduled press conference is Thursday, April 23rd at 3:30. I would just like to briefly summarize the Linn County metrics to date. Linn County currently has 456 cases, 29 deaths, and 177 individuals that have recovered. Please practice social distancing. Stay home when you're sick and wash your hands. Stay home and stay safe. Thank you.